Yo, what up? This is Josh Rubin from East West Healing Improvements, and today I want to talk about the prostate. Now, I'm not going to here to give you solutions. I'm just here to educate you on what I've found. A lot of this information is from our program, the Metabolic Blueprint, as well as from the work of Dr. John Lee, as well as from the work of Ray Pete, PhD, and some research from Harper and Wilson. So I'm not here to really tell you what to do if you have prostate issues. Really here, I'm here to kind of give you my thoughts and interpretations of what I studied and read, and based off of working with people, so you understand possibly what's going on. Hopefully by the end of this you do. It's a YouTube, so maybe it just sparks some thoughts. You can do some more research if you're suffering and you're taking these supplements to help with prostate issues, or BPH, or even prostate cancer. That for one, of course, I believe a supplement, the right supplement, I'm not going to say what kind, because it's all individualized in my opinion, but a supplement can be of benefit. The problem is if you don't have the nutritional foundation to actually modulate the stress of aging, the stress of hormonal imbalances, the stress of anything, the stress of weight gain, the stress of your midlife crisis, etc., the supplements aren't going to do anything. So the nutrition is a foundation for this, because when it comes to BPH, prostate issues, whatever it may be, for us and based off what we've read, it's basically influenced by a deficiency in the immune system as well as an estrogen dominance. Now, an estrogen dominance meaning, as I talked about 1,000,001 times, you can have excess estrogen, normal progesterone. You could have normal estrogen, low progesterone, deficiency in progesterone. You could have the inability to detoxify estrogen. You could have high estrogen, low progesterone, etc., etc. You could have blood sugar handling issues, which is stimulating estrogen. You could have high prolactin levels from calcium issues that are stimulating estrogen. It could be from taking the birth control pill, exogenous sources, etc., etc. So it's really looking at the person and figuring, okay, this person has an estrogen dominance. What is it, though? What is it with this person? Because with estrogen, of course, it causes cell proliferation. And in BPH, this is very common. Now, according to Dr. John Lee, MD, who I admire and really love his work, BPH affects 40% of Americans, men over 50 years of age, and 70% over the age of 60. Remember that aging is estrogenic. Now, Ray Pete says this all the time, but Ray Pete's a quack. But John Lee says it, and everyone listens to it. Aging is estrogenic. It doesn't matter if you're male or female. Because of the stressors in our life, and because of our lack of awareness of the awareness around the foods that we're eating, the external stresses, overtraining, undereating, etc., etc. The most common symptoms are frequent urination, especially at night, and a continual inability to completely empty the bladder. Now, by the age of 50, most men often show an excess of both prolactin and estrogen, and a deficiency of thyroid and progesterone and testosterone. And this is kind of the catalyst of which causes the BPH to actually come about. So we could say that these people are actually hypothyroid, and an estrogen dominance is actually a main causative factor, one of the main causative factors, as well as hyperadrenaline, or eating a diet high in unsaturated fats that's causing hypothyroidism. Now, there's two types of BPH. You have hypertrophy, which is enlarged cells of the prostate, or hyperplasia, which is enlarged by an increase in the size of the cells of the prostate. So there's two different types. But in reality, we'd say, okay, there's basically this proliferation and this growth. Now, commonly what we see as people age, because aging is estrogenic, estrogen typically rises in men at old age, as we said, typically around the age of 50. It's obviously happening as we are growing. We can modulate it better because in our younger ages, we're producing more hormones at a higher rate, protective hormones, but as we age, we produce less, and because of the things we're doing in our life and the things we're not doing, we actually produce less. We're in the survival state. We push ourselves hyperadrenaline and hypercortisol, which can lead to these hypometabolic, hypothyroid-like symptoms. So estrogen typically rises in men as they age from stress, malnutrition. Malnutrition maybe meaning eating the wrong foods, but maybe not eating enough. You know, of all these people saying, well, I'm eating the Ray Pete diet. I'm eating, orange juice and fish and shellfish and gelatin and milk and ice cream, which it's not, but, but I still don't feel good. The problem is that's malnutrition. Because if you log your foods and you look at, just we'll simplify it, the amount of calories you're taking in a day, most people are not meeting their metabolic needs. I don't care if you're taking in 1,000, 1,500, and 2,000. If your body temperature and pulse are not regulating and you still don't feel good, then you're not meeting your metabolic needs at the cell level, and you're not meeting the demands you're placing on your body with the foods you're actually taking in. So that's malnutrition, as well as hypothyroidism. So as T3 declines, this lowers pregnenolone and progesterone, which causes DHEA levels to rise, as everything is a stress. Now, there's many things that actually causes T3 to actually decline. Of course, any stress can do this, radiation, dioxins, the foods we eat. But with what we're talking about, two main factors in this is unsaturated fats, which are estrogenic, because they pull, they actually cause estrogen to be separated, we could say, from the proteins that they're bound to in the blood, which makes them more bioavailable to the tissues and the cells in your body, which, as they do this, at the same time, in the liver and in the cells, they inhibit the conversion and the use of T3 and the cell's use of glucose. At the same time, estrogen inhibits the conversion of T4 to T3, which lowers T3 production. Alright, so we're talking about estrogen, and I've actually done a video on vitamin A and the importance of vitamin A, and I'll actually maybe post that in the description down here, a little blog on it as well. But you have to remember that with estrogen, vitamin A plays an important role, because vitamin A is actually anti-estrogenic. Vitamin A actually is a precursor to progesterone, so we can kind of make the, I don't want to use the word assumption, but the connection that vitamin A is actually anti-estrogenic because it actually produces progesterone. So it's actually been shown by the work of Ray Peat and researcher Ray Peat that a vitamin A deficiency can actually cause cells to proliferate, and that's exactly what's going on in BPH or prostate issues, because if you're vitamin A deficient, you're actually not producing progesterone, which is common in men as they age, which actually equates to an increase, or we could say an increase in the amount of estrogen, or the inability of the body's to detoxify it, as well as having this progest deficiency, which causes estrogen to become dominant, which causes cells to proliferate. So it's important to remember that, and you can get a lot of the vitamin A that you need from the foods that you eat, which I talk about in the video. So it's important to remember that it's not always about estrogen, it's always about finding that correlation between what's going on in your body and your environment, the foods you're taking in, the precursors and things like that. Now, it's important to remember that as we age, and I talked about aging as a stressor, when most people get, not everyone, but most people get to this certain age, they start to gain weight from the stresses, emotional stress, having a family, financial stress, working out too much, not working out enough, not eating the right foods, not regulating blood sugar, whatever it may be. And what typically happens with people or men at this age is they typically gain weight or fat. Now, you have to remember that estrogen is actually stored and produced in fat cells. And fat tends to increase as we age, and it actually increases when people are thyroid and progesterone deficient, because we're in this hypometabolic state, and weight gain is actually a sign of a damaged metabolism. So the more weight you gain, the more estrogen you're producing, the more you are, especially if you're eating a diet high in unsaturated fats, the more you're creating, or the more estrogen is actually bioavailable to have an effect on your tissues and the cells in your tissues, which affects thyroid metabolism, which pushes you further down the path, which leads to increased cell proliferation. Now, it's also important to remember that testosterone is converted to estrogen in the testicle itself when we're in this hypometabolic state. And estrogen causes cell proliferation, especially in the prostate itself, where there's receptor sites for estrogen, just like there's receptor sites for estrogen on the beta cells of the pancreas. So there's many receptor sites. So the more weight you gain, the more vitamin A deficient you are, the more hypothyroid you become, the more hypometabolic, the more estrogen you become, the more weight you gain, the more you produce, the more you store, the more it affects how your cells work, and the more you convert your protective hormones into, I guess we could say, excitatory hormones, which are going to facilitate the disease process that you're actually already in. Now, according to Ray Peat, PhD, blood sugar handling issues, liver dysfunction, environmental estrogens, dioxins, radiations, and unsaturated fats can all create the stress reaction in the body. Estrogen is a part of this reaction, along with prolactin and aldosterone. These hormones are considered to be inhibitors of metabolism, like I kind of just talked about, anti-hair, and cause cell tissue catabolism and proliferation, and that's the most important thing. So it's important to remember that blood sugar handling issues can raise estrogen. Estrogen weighs glucose, which can lead to hypoglycemia. It actually wastes B6, which stimulates excess prolactin production. Prolactin stimulates estrogen. The liver dysfunction, having a biliary issue from not breaking down your foods, overloading the liver, having excess endotoxin, bacterial endotoxins, all these different things overload the liver, which can lead to the recirculation of estrogen, which can lead to the, a sluggish liver per se, which can lead to increased cholesterol, which can lead to blood sugar handling issues, the lack of conversion of peripheral T3, etc. So all these things affect how our body balances its hormones, as well as eliminates the very hormones that are causing the cell proliferation in our body. Now, as I mentioned, prolactin stimulates prostate growth, or prolactin stimulates estrogen, along with growth hormone and ACTH. They actually stimulate in excess prostate growth because they actually increase estrogen. So prolactin can be increased by estrogen, but also increases prolactin. So it's kind of a little vice versa thing. So these things, prolactin increases estrogen. This is why in excess prolactin, growth hormone, and ACTH actually stimulate prostate growth. And at the same time, it's been shown, and we did a blog on this, and I'll post it down below as well, that luteinizing hormone increases when progesterone is actually deficient. Now, reading a quote from the work of Wilson and Harper, it's a long quote, kind of going along the lines of luteinizing hormone and estrogen and progesterone deficiency. This is from the Metabolic Blueprint. Prolactin is increased by estrogen. Estrogen stimulates ACTH and growth hormone, increases under a variety of stressful situations. Luteinizing hormone, or LH, increases when progesterone and testosterone are deficient, and growth hormone and prolactin increase, thus creating more estrogenic stimulation, which leads to the cell proliferation and our vitamin A deficiencies. Prostate cancer patients who had higher levels of LH and low levels of testosterone died more quickly, according to Harper. A high ratio of testosterone to estradiol or of testosterone to prolactin corresponds to a better survival ratio. Patients with higher testosterone levels had a better diagnosis than those with lower levels, and patients with low growth hormone did better than those with high growth hormone levels, according to Wilson. And this is from Ray's research. So you can see how having these deficiencies, being progesterone deficient, being vitamin A deficient, how it can lead to this, indirectly lead to estrogen dominance, leading to high levels of LH, leading to the cell proliferation of the prostate, as well as leading to cell proliferation of many tissues and cell tissues, or cells of your tissues in your body. So it's important to remember what's going on in this. I know there's a lot of information here, there's a lot of mumbo jumbo. The bottom line is this, is that when it comes to BPH or prostate issues, it's usually a sign of immune system deficiency as well as estrogen dominance. Now, of course, it's important to figure out why. Am I older? Is aging a stress? Do I have more weight on me? Am I hypometabolic? Am I vitamin A deficient? Am I not converting my T3? Is it exogenous sources? Am I not regulating my blood sugar? Am I not detoxifying estrogen? All these things are going to lead to an increase in other hormones. Am I not absorbing calcium? Am I leaching bone calcium to regulate my calcium levels? Am I in an inflammatory state? Do I have excess levels of PTH and prolactin, which are leading to excess estrogen production, which is causing cell proliferation, which is leading to the prostate issues? So there's all these factors to think about. The bottom line is you have to think about them all when you're working with yourself or you're working with a client. It's important to understand the person in front of you, what's going on, and why they might have prostate issues. It's not about just doing this or doing that for prostate issues. Everyone has different needs. It's not just about giving these men, which can be of benefit, giving these men progesterone E, which can be a huge benefit if the nutrition is not in place. But I've actually seen the progest E not help some people and the nutrition help 10 times over. Or progesterone and using pregnenolone. Or just losing weight and eating healthy and regulating blood sugar. Or regulating their blood sugar, regulating cell energy metabolism, and pulling themselves out of this hypometabolic state, and increasing the conversion of T3, getting better sources of foods with vitamin A in them, has actually helped a lot of people. So it's important to remember that there's no one size fits-all approach. It's important to understand what's going on with all these conditions, not only prostate issues. So hopefully you enjoyed this YouTube clip. I'm out of here.